All right again. So just laid down and had a really quick nap. And now we're going to go over some tips for after surgery. And I've got a whole bunch of props here to help out with that. So just as going into surgery, you're going to get a nice handout with all sorts of instructions. You'll also get instructions afterwards. Whoever is going to be taking you home will also have instructions read to them, because with the different types of anesthesia that's used, there's a good chance you won't remember a word of what they say immediately afterwards, and maybe for the next day or so, depending on how the medication affects you. So basically, this one is talking about when laparoscopy type of surgery is done, which is one of the more common types of abdominal surgery. If you have a choice, it's generally preferred to do a laparoscopic procedure because the recovery time tends to be a lot faster with that than with the larger cuts. And so the anti-inflammatory, such as Motrin, is very highly recommended afterwards to take it regularly every 8 hours, and an oral narcotic such as Percocet or Vicodin. And the reason that they don't recommend taking the Tylenol, although it's another good pain medication to have handy, is because after surgery, when you're taking the strong stuff like the Lortab in this case, it comes preloaded with Tylenol, and so if you're taking Tylenol plus a surgical medication such as Lortab, it can be very easy to overdo the Tylenol on there, and so that's why they specifically talk about things like Motrin or Naproxen instead. And then also the narcotics and the anesthesia do cause difficulty using the bathroom, especially in the case of constipation. And it can be very painful sometimes to have that first bowel movement. And so that's one of the reasons why if you're not already on a whole food plant-based diet, which has a lot of fiber naturally, then going into surgery might be the perfect time to get started, because the beans, the rice, the lentils, fruits and vegetables are very good. And prune juice, forgot to bring the prune juice, but that can be very helpful as well. One of the things I learned from the first surgery was don't delay on starting the process of getting the bowel moving again. It's very natural that when somebody goes into your belly in a surgery, kind of messes up the mojo of the gut, so to say, and just that alone, not to mention all of the other stuff that goes on during surgery, can cause the bowel to slow down or to kind of stop a little bit. And so that's one of the reasons why after a surgery people might be surprised to wonder, why do these nurses keep asking me if I've farted yet? It's important because it shows that the gut is waking up and starting to work again, so the gas is of the utmost importance. But it's also very vital to have that first bowel movement be easy and soft and not any strain at, because especially if you have incisions down in the abdomen area, you're going to want to have as little pressure as possible to cause that bowel movement to go. So I was thinking about the squatty potties and other accoutrements to helping with that. It can be very helpful. And depending on the thing, they're going to talk about the different type of dressings that are going to be used. You might get sent home with some additional types of gauze and dressing. So here's some gauze, for example, that could be used to help with the dressings. And then the emergency precautions are going to be very important for you to know, but also for your caregivers to know. Fever, temperature over 101. The act of having a surgery done, excuse me, of itself will cause the body to react with a low-grade fever. That's normal. That's part of what happens with the body healing. But if it goes over 101, that could be a sign of infection. So those would be reasons to go to the emergency room. If you're having worsening pain and your good old bottle of good stuff is not helping you to control the pain, that's a reason to go to the emergency room. Surgeons don't mean to, but occasionally things can happen that are unexpected. For example, they might maybe have a very small cut to the bowel or something that doesn't have immediate signs of infection, but which can cause problems, especially in the first few hours or days. So that's one of the reasons why these precautions are needed. Significant nausea and vomiting, inability to tolerate any food or medication. It's very easy to get dehydrated after surgery. You've already been nothing by mouth for hours and hours before the surgery. After the surgery, you feel terrible, so you don't want to eat anything really right away. And then significant redness of the incisions or drainage from the incisions. So that is also a sign of infection and things that may need to be looked at. Sometimes if the incision gets infected with something like MRSA or something, then the edges can pull apart and sometimes can let things in a little bit deeper than you want. So that's why those things are on the quick list of reasons to go to the emergency room. Usually, normal activities and exercise can happen within 2 to 4 weeks. Generally, driving is also restricted for the first few weeks as well. You may notice soreness with abdominal exercises. The incision areas will have a different kind of soreness than the deeper areas that are worked on. No lifting greater than 10 pounds until 4 weeks after surgery. And you may have sex 2 weeks after surgery as well. So anyway, so they'll give you very explicit directions. And if the printed directions are not adequate to you, if you have any questions, the time to think about that is maybe before you go in the surgery. But also remember that your surgical team and nurses should be available afterwards as well. And you might think of stuff, a day or two later. And so getting into some practical tips for getting out of the hospital and going home. So as mentioned in the first half of tonight's talk, which was before talk, having a trusted friend or buddy or companion that can stay with you overnight, and preferably in the same room or very nearby in case of any trouble, can be very, very helpful. Part of it is that when you're out from the surgery, the memory is wonky, the mind doesn't think nearly as clearly as beforehand, and it can be very helpful to have somebody be nearby that can keep track of, for example, your medications, that can follow the instructions that are on the bottle and make sure you don't take too much or too little, and so forth. So one of the things you're going to want to have handy is a pad of paper, and here I just happen to have some random drug company stuff handy with things that I could scribble notes on. I was surprised at how sore my voice was after the surgery. I'm still not recovered from that yet. Excuse me. because when intubated, the laryngoscope passes through those vocal cords and can cause some swelling. And so you want to try for a good while afterwards not to talk any more than necessary. And so having a pen and paper nearby can be very handy as a communication tool. Another thing that I found helpful was to simply draw on a piece of paper a few words that I could point to, and also was prepared the second time around to do a little bit of a signaling language to help out with the recovery as well, because I found it very difficult to speak. And if somebody's in the room next door and you can't really talk well and your voice is weak, you can't just go, hey, or maybe you can, but suffer the consequences of the sore throat after. So sometimes when people are intubated and awake in the hospital, we'll talk to them about having an eye blinking thing. So one blink is yes and two blinks is no, kind of thing. And so you can draw things on a piece of paper. So sorry, it's backwards, but for this it's yes, no, maybe, I don't know. And we came up with a whistle for please help or come now, and something for basically it can come help me out with something, but you can take a minute or something like that if you're doing something else. So I found that since talking was difficult, whistling was something that could be done to communicate, and the nice thing about that is it's distinctive and it could carry across a few rooms of the house. So for example, with this whistling language, yes was, no was, and please come, or something along those lines. And if I felt like I needed something very urgently, we came up with a kind of thing so that it just was something different, you know, kind of corny, but I'll tell you, these communication tools really helped to rest the voice and also to communicate as well. And so that might be something to think about afterwards. Also, so the pre-op meal. So with my first one, I was done kind of early in the afternoon, and so stores were still open, so we stopped by and got a smoothie that had some basically berries and carrots and ginger and other kind of good stuff cold in there. And that was, I felt, very helpful because of the colds, or the coolness of the drink was soothing for the throat. The berries are well known to help reduce muscle soreness, and they're also very anti-inflammatory, very good for you in general. Obviously, if your surgical team has different suggestions for you, follow that as well. Something else that I found to be very helpful, in one of Dr. Greger's videos about functional constipation, he mentioned that club soda, just a brand name of something that we grabbed at the store, can be very helpful with relieving temporary or irritable bowel constipation kind of stuff. And so chugging down on club soda or mixing it with your other fluids and things can be very helpful for getting the bowels going. Also, speaking of foods, cherries, again, talked about cherries a lot over the last videos, but cherries, not only are they anti-inflammatory, but they also have that bright red acanthocyanin pigment, which is kind of similar to your Motrin in being able to help with aches and pains and soreness. For nausea, I found that they did provide some lovely bags. See, new technology, little bag, and then you can actually expand it out and measure, so you know exactly how much you throw up when you throw up. And these kinds of things are very helpful because sometimes if you use a regular plastic bag or something, the acidity of vomitus sometimes can burn holes through lesser bags. So in a pinch, something like this for a car ride or something can be handy, but you might also want to have something a little bit sturdier, like a bucket to go home with just in case you need it in the car, so this should be close at hand. Also, for helping with nausea, I found at the health food store they had these cute little candies, ginger candies, 10% fresh ginger. There's a million ways in which you can have ginger, but I found these to be soothing afterwards. And a couple other things. Again, in the realm of constipation, getting that back area working faster. Basically, the sooner that that's worked on with things like the club soda, the better and easier it will be ultimately. So the goal, soft, large, easy to pass. So picking up and grabbing things like Miralax, this is Docusate, it's a stool softener. Nausea medications will sometimes be given, so this is some Zofran, for example. In my experience, the ginger and the Zofran work about similarly, but everybody's a little bit different, and of course, always discuss your medications and herbals with your surgeon because some of the herbals do increase likelihood of bleeding, for example, and I think that ginger potentially can be one of those. Also, when having these things, for example, the lots of Motrin, especially if you're not used to taking it, can trigger some heartburn. And so having some Zantac handy or other heartburn-style medications can be useful as well. A lot of people are on those PPIs, Nexium, Prilosec, and other medications in that category. Those are not going to kick in fast enough to help you with your heartburn after the surgery. That can be caused by the ginger and by the lots of the NSAIDs, the Motrin, can be very troubling to the stomach, whereas the Zantac, that one will kick in pretty quickly, and so usually people can do this once or twice a day, and that's over the counter as well as available from your surgeon. For the sore throat, something like Sucrets or those sore throat sprays can be really helpful. I found that gargling salt water was very helpful. It had a surprising amount of mucus and everything up in the sinuses area, and I think that was contributing to the sore throat a little bit, and so neti pot can be a really good best friend to have afterwards. Having a thermometer, because as you saw in the post-op directions, you need to be able to keep a temperature afterwards, and so having a thermometer handy ahead of time, if it's been a while since you used your thermometer, locating it or getting a new one, making sure the battery works, all that good stuff can be done ahead of time. Other things that can help in terms of the bowels going, so there's many varieties of things that can be helpful. If there's soreness afterwards, something like the Preparation H or other similar kinds of ointments can be helpful. Glycerin suppositories can be helpful as well. Those are, as it says, gentle and effective. And one of the things that's nice about something like this is that when you have surgery and you're under anesthesia for a long time, anything that happens to be in the colon before you go under is going to be sitting there drying itself out, because that's what the colon does, is it soaks up extra moisture, and it can make the first stool or so very hard and dry and difficult to pass. And what's nice about this glycerin suppository kind of thing is that it can basically rehydrate that back end a little bit, and so make it a little bit easier to pass. Speaking of things that can loosen the stools, so in the realm of laxatives, there's something called magnesium citrate. You can get in a little bottle and drink. But one of the side effects of an oral magnesium supplement, such as this, is it can also cause loose stools. And so not only can you do something like the DocuSate official stool softener, but something along the lines of little magnesium supplement can be very helpful in just loosening things up and softening it for the way out. Another of my favorite things is fennel seeds for reducing the discomfort of gas and bloating. And so the way I use these is, for me, I just take a few of them and literally shake out. I'll demonstrate here. About yay much. Literally, it's trying to figure out how to do it on the camera. On the palm of the hand, chomp them up, chew them up, and swallow. And there's an enzyme in the fennel seeds that helps to break up gas bubbles in much the same way that simethicone does. But the difference is you don't get the side effects from the fennel seeds. And they're cheap. You can get them at the local grocery store. All right, so that's pretty much everything in that basket. Next, speaking of other things that can be helpful to have at home before you go, is basically things like these little frozen fruit bars. This is a nice brand just because it's got literally like no additives other than things like, in this case, grapes and strawberries and bananas and stuff that's relatively easy to digest. And so being prepared with things on the end can be helpful as well. I don't usually recommend things like processed foods, but sometimes something that's very simple, like these pretzels, for example. These ones happen to not have any fat, and it's enriched flour rather than a whole grain. Obviously, if you can get a whole grain, it'd be a little bit better, but it's a little bit hard to. There you go, you can finish that off. Sorry, my assistant is snacking on my demonstration things, but also things that are easy on the belly and can help with recovery. We've talked about soy milk yogurt. I have a demonstration video on that. If you check out the table of contents, you can find that. And rice. So the basics for nausea: small meals, bread, rice, apples, toast, things that are very light. So the time for having your giant meal is not right after you have a surgery or even in the next few days. Also, there's been some studies on turmeric and post-operative pain. And by using the equivalent of a quarter teaspoon of turmeric 2 or 3 times a day, not only does turmeric help with loosening the bowels if your body's not adapted to it at that higher dose, but it also does have a very good anti-inflammatory effect, and it was studied in India and found to be about comparable to some of the narcotics for the post-operative pain meds. I can't say honestly that I know how much of this was helping me, but I've been very light, let me say, on the narcotics afterwards, and I think it was partly because I've been using a variety of methods to treat the pain. Next, I am not an expert in homeopathic stuff, and in my personal take is I usually don't recommend homeopathic kinds of things, maybe partly because I don't know very much about it, but my surgeon actually, because I was having some things worked on in the uterus type of area, she was saying that arnica could be helpful as well, so we picked up some arnica. And apparently it's most helpful if you start a few days ahead of time. But anyway, so that is another thing that may be helpful as well. Now, speaking of surgical pains, another thing that I was not quite prepared for was the amount of discomfort from the surgical gas that's used. So in order to do a abdominal laparoscopy surgery, they make some holes in the belly, belly button, and then 1 or 2 or 3 or 4 ports, depending on how many instruments and what they're doing and what they need to do with it. And then in order to be able to see around in there, the entire belly is filled with carbon dioxide gas. And that gas, when while it's in the process of dissolving, it can be very irritating to the diaphragm. And as a meditator and a teacher of diaphragmatic breathing, I found it a little challenging to be able to have some nice, good diaphragmatic breaths right after the surgery, and had to really focus on and concentrate on that in order to bring that relaxation response that goes along with diaphragmatic breathing. And when the diaphragm is irritated, the nerves that line the diaphragm also line the shoulders and the neck area as well. And at first I thought it might be because when you're under surgery, your arms are up and kind of out and rotated, and the head is kind of back because of how the tubes and everything have to go in. And so at first I thought maybe the shoulder pain was related to that, and then I realized no, it's very, very common after a laparoscopic surgeries because of that irritation of the diaphragm for there to be shoulder pain. I found that using some of the herbals that are commercially available were actually helpful with that. You might think, surprisingly not, because if you're irritating the diaphragm nerves here, how would this help with the shoulder? But basically, it can cause muscle tightness, and using these creams was very helpful. So for demonstration, this is the good old 2 Old Goats cream. Learned about that during my Mississippi years because one of my technicians, the folks at the nursing home were swearing by it, and they sold it at their local store where you pick up like cow feed and stuff like that. So it's an arthritis fibromyalgia lotion. This one has lavender and chamomile and rosemary and eucalyptus and peppermint and birch bark. Peppermint is probably one of the most common things that you see in the over-the-counter things. This is Biofreeze. The active ingredient is menthol, which is essentially mint, and that can give a cooling pain relief. Boswellian cream is another, Boswellia is another thing that can be helpful. This particular version also contains caspacin, which is basically a derivative of hot peppers, and methyl salicylate, so basically something like aspirin for good measure as well. So, of course, there's diclofenac and other topical versions of Motrin and things that can be rubbed into the muscles as well. This is one that is a brand that is popular on cruise ships, the Elemis Refreshing Gel. This one has arnica, birch, and witch hazel, and camphor and menthol. So again, that mint or menthol comes up a lot as well. But I found pretty much almost interchangeably these kinds of things were very, very helpful with the neck and shoulder soreness after the surgery. Another thing which was very, very helpful as well was the very simple joints and glands exercises. For obvious reasons, the abdominal exercises were avoided during this recovery time, but the very simple act of putting the awareness in different body parts, very, very gently moving the neck, very gently moving the shoulders, kind of rotating a little bit here, a little bit there, moving the awareness through the body and moving the joints in turn is very soothing and can be very helpful. I was joking with my family. I've got a little bit of a sense of humor with these things. I felt either like had gotten beat up by like the surgeons had hired like little clowns with batons or something like that to just kind of beat up on the back or something. Anyway, just when you come out and have that muscle soreness, you do really feel like you got beat up on. Kind of similar muscle soreness to when you get the flu. Actually, recovering from surgery is actually very similar to recovering from an influenza. Let's see what else is on my goodies. Alrighty, breathing apparatuses. So this is something I kind of wish that I'd had handy after my first one. Usually this kind of thing is given when people are staying overnight in the hospital and they've had major surgery, chest surgery especially. And what this does is it basically forces the lungs to kind of expand, and it keeps your lungs from forming these little collapsed patches. We call it atelectasis is the fancy word, but if you imagine the lungs as being like hollow grapes, occasionally one little section or cluster of them can kind of get squished down, because if you're in pain and your diaphragm is irritated, it can be challenging to do deep diaphragmatic breathing. And so it's very easy to go into that shallow breathing mode. And so this helps with that. You just kind of inhale on it, and it makes the little thing go up, and can trigger a cough. It can help mobilize any fluids that might have gotten inhaled during it. And so this kind of thing is usually recommended to do, usually whenever you remember, maybe a couple puffs an hour or something, or whatever is comfortable for you afterwards. Certain surgeries, they'll also give you this other device. It was playfully called the pickle because basically it looks like a pickle. But this one, yeah. You breathe out into it, and it gives a kind of a gentle percussing to the chest. And so if there's things kind of sitting in this area, this little device can just kind of gently shake it out as well. So these things are not needed for every kind of surgery, but if you happen to have them handy, sometimes they can be very helpful for just reopening up those lungs and helping you to be out and about a little bit sooner. And this prop is just a reminder to mention that sometimes after having those difficult, hard to pass bowel movements, it can be nice to have a bottle of warm water sitting right next to the toilet in order to be able to rinse off that backside area to just help to soothe the tissues as well. If you have a pinch of salt in there, it can be helpful. Sometimes people use witch hazel tux pads and things like that as well. Alrighty, so that's kind of most of my props that I brought for the show and tell tonight. A little more than I was expecting to have, I guess. Let's see, other things. Everybody recovers from different surgeries at different times. Everybody responds to anesthesias differently. I had a lot of nausea after the first round of chemicals or whatever it was that they were using in there, and so when I went to the second time, I told the anesthesiologist that, and they were able to do a different concoction. That concoction gave me a lot of vertigo, and so we're feeling like I was on a boat, but there wasn't anything happening, like no awesome ocean or, comedians or anything like that. Just felt like the world was kind of moving a lot. And so even with the same person, the length of time that somebody's under for can also make an impact on the recovery time. The longer, excuse me, the longer that someone's under anesthesia, the the chemicals that are used, basically they go into the fat tissues, and so the fat can kind of serve as a storage of those chemicals, and then they, as the body works on clearing them out, that can give a slow release of those back into the bloodstream over time. So after surgery, don't have a lot of expectations for yourself. Try to get things done ahead of time that require heavy lifting, like doing cat litter boxes and things like that. Because when you're lifting only 5 to 10 pounds afterwards at a time, that's where having those extra hands or set of support network can be very helpful as well. I've done a lot of sleeping in the last few days, even between the first video and the second one. I found I got a little bit extra energy by lying down for a few minutes to take a really quick breather and rester. And gonna be lying down again in a few minutes myself as soon as we finish. But basically the amount of time that's spent resting is to be expected. If you're able to get up and do a little bit of walking activity during the times that you're awake between naps, that can be helpful for recovering a little bit faster. I remember when I was doing my surgical rotations, they would encourage people to get up and walk in circles around the nurse's station. You can do something similar at home. The other benefit to that early movement is it helps prevent blood clots, and that is something that can happen after surgery, because if you're lying still for a long period of time, or bedbound or close to bedbound, basically the blood has a lot more tendency to clot, and can have obviously deadly consequences if a blood clot goes to the lungs. It's called a pulmonary embolism, and so if you get short of breath suddenly, and or a hot swollen leg after surgery, or just completely feel lousy, I guess, those would be things to watch out for. And that's one of the reasons why they encourage people to, even though you feel terrible, have a walker, have something that you can use to move the body around a little bit. And this is one of those times where having a lot of self-awareness, and also basically being able to kind of keep track of what your abilities are is going to be very helpful as well. So some of you might notice that I'm not in clinic this week, for example, because between the surgery that kind of kicked my butt way worse than I was expecting it to, and the lupus, it just am not feeling up to a full day's worth of clinic at this time. Alrighty, so go easy on yourself. It does take a little while for the tissues to fully knit. For full recovery of surgery tissues, they say you can do most things within a couple of weeks, but honestly it does take about 6 weeks, sometimes even longer, for that scar tissue to give a nice, really tight bond. So I think that's all I have the energy for tonight. Thank you for joining me for post-operative discussion, lessons learned. So this is art imitating life, I guess, trying to use a recent life experience just to share with you guys things that you might find helpful. There are some really nice articles to read over as well. The more that you know, or the more that you know if you're taking care of somebody that's going through surgery, the better it is and the safer it will be for you to be able to take care of each other. Alrighty, so have a good night and stay well, and I hope you don't have to go through this. Alright, but if you do, talk to me. I could give you a few ideas. Sometimes it's nice to, as a physician, to remember what life is like on both sides of the table as well, because, we're all human, right? And sometimes the unexpected can happen as well. So, love you guys, have a good night, and I'll see you again next time.